Hello, everybody. Dr. Michael Beebe here from Arete Chiropractic, and we're on our collaborative business series, and we're thrilled to be hosting Karen Drelick with Rejuvenations Professional Massage
Hey
in
everyone,
Exeter. Karen, thanks for being here.
not a problem.
So the purpose of these conversations is really to just have an informal discussion about exactly what we are doing in our businesses as we're serving the Seacoast, to let people know what we're doing, how we do it, and then what we're doing in our offices to help reduce any effect of COVID-19 and decrease any risk of possible transmission or infection, and then what our vision is for the population of the Seacoast as we start to emerge from this pandemic. And so we really hope that you get great information from this talk. And Karen, go ahead and share a little bit about your background, what inspired you to open a therapeutic massage office, and what kind of patients you typically see.
Certainly. So my background before massage therapy was I was a licensed physical therapist assistant since 1987, working in Portsmouth Hospital, both inpatient and outpatient programs. While at the hospital, I worked with people that had COPD for their respiratory exercise programs. I've worked in ICU levels, and of course outpatient levels and wound care. So I bring all of that up because from that background, my business, even before the coronavirus, was very well prepared as far as sanitation and meeting all of the guidelines set forth from the hospital. And the reason why I went into massage therapy is because in physical therapy, you're bringing people to about 70-75% better, and then sending them off on their own so that they can do their own exercises, which, let's be honest, most people don't do.
I don't.
So I wanted to make sure that I was not only helping people get that extra 25%, but also working with people so that they didn't need physical therapy to begin with. So Rejuvenations Professional Massage is very much a therapeutic massage practice. We help our clients with medical billing if their insurance covers. We don't do the billing ourselves, but we provide them the proper coding so that they can get it covered themselves. We see clients of all different ages and different diagnoses. I myself, I do cranial sacral work. I've worked a lot with you guys in Arete for migraine management and different types of things like vertigo and that nature. We do acupuncture. We're going to be doing acupuncture. That's actually going to be coming up in the summer. I'm bringing on an acupuncturist. So it's very much a medical model. And we do cupping massage and Graston technique, which is a deeper fascial technique. And it's really about, our practice is really about preventing injury and recovery. So those are our two things. Interestingly enough, because of the COVID, I put a survey out there for clients about our services and getting back into practice. And it was really humbling and just nice to see the different responses we got. One that was really touching to me was one of our clients with MS. The massage has been very, very helpful for her for maintaining her health and because we can't cure the MS, but we can keep her comfortable so that she can keep moving forward and doing her own daily activities. And those are the type of people that we see. We see the people that really need services to help them with their everyday life.
Yeah, and I know from personal experience that we have referred a lot of patients back and forth over the past couple of years that we've been in the Seacoast together. And, with the chiropractic care, we work on the bony alignment and how that affects the nervous system. And then the massage therapy really can help with the soft tissue management. And it is just hand in hand, because there's a huge difference between a relaxation massage, which is valuable, and a therapeutic massage, which helps either manage chronic illness or recover from injury. And you
Right.
guys do a phenomenal job of that. And we work together all the time and we co-refer patients because patients often need both the structural
Yes.
aspects of the upper cervical chiropractic care and then the soft tissue aspects of the massage therapy. I think it helps our patients get better faster.
Yes.
With the chiropractic care at Arete Chiropractic, we are kind of, as you know, from the top down, right? So we're
Right.
looking at the craniocervical junction, or where the head and the neck meet, and we're specialists in that upper cervical area. And the top things that we see are headaches, neck pain, and head and neck injury. And unfortunately, when people have, concussions or whiplash injuries, or even just slips and falls and bumps on their head, they can disrupt that ligamentous connective tissue that stabilizes the upper neck, and then it allows the bones to lock out of place, which then affects the nerves. And then the nerves don't fire evenly, and your nervous system is the master control system of your body. So when we get that head and neck in alignment, it takes the interference off of the nervous system, and patients with chronic migraines, vertigo, neck pain, whiplash, numbness and tingling, radiculopathy down an upper extremity can see significant changes. And then, if there is a bit that's just not coming back because of the fascial restrictions or adhesions, like that's when we refer with you guys, and it's just wonderful to see how the patients can respond. Yeah, go ahead.
Yeah, and I actually just want to say just a little bit of background on how we met.
Yeah.
My son-in-law had a concussion injury where he had something fall on the left side of his head, and I was working with him, and just, C2, C3 was just not holding into place. There was a transverse shift to the right, and I found you guys and called up and explained to Dr. Evans, I believe, what was going on. And he said, wait a minute, who's this person and why is she speaking my language? So, very happy to say that my son-in-law is doing much better, but I went with him for his initial eval and from you guys. And I was so impressed that it wasn't just looking at x-rays and the 3D x-rays that you do, but it was also checking his balance, checking his coordination, and all of the things to see how he was doing functionally. And I think that's what impressed me most about you guys. It's not just you go in, you get on the table, and then goodbye. You get fully evaluated, you do the proper adjustments, and then what's even more important, they go into a quiet room and relax to see if that adjustment's going to hold before they even leave your office. And I think that makes you very unique.
Yeah, thank you. Yeah, we do strive to have fewer adjustments than the average or typical chiropractic, so that people can stabilize more on their own rather than needing to run into getting adjusted once a week for the rest of their lives.
Right.
And COVID-19 is on everybody's mind, and as healthcare providers, we are on the front lines working with this. Now, chiropractic was fortunate enough to be deemed an essential business, and we have been open throughout this entire pandemic, and we've taken massive strides to try to help prevent any risk to our patient population, to our staff, to ourselves. And so every morning we're taking temperatures, every afternoon we're taking temperatures. People can request that we wear gloves, we're wearing masks, we're sanitizing all the high touch surfaces. People can wait in their car, then we call them in, then they can choose to recover. You'd mentioned resting in the office, so instead of resting in the office, people can now choose to rest in their car if they'd like, just to minimize any possible risk. And then if there are people who have loved ones at home that are immunocompromised, or if they're in an at-risk population themselves, we have a special populations appointment available where we try to even further minimize any other patients in the office to, again, minimize exposure. And so we're taking a lot of strides to try to help people feel comfortable and be as safe as possible as we start to reopen New Hampshire. And I know that you guys have started to put in a lot of extra efforts on top of what you were already doing.
Yes.
So go ahead and share a couple of those efforts you're doing.
Certainly. Well, I had the great opportunity with working with the spokesperson, her name's Vicki, that was directly speaking to the New Hampshire task force for massage therapists on what we need to do for our protocols moving forward into our world of COVID-19. I sent her my proposal of what I'm planning to do with my office, and she and I agreed with that. And then where we're a multiple room office, I typically have 7 employees working with me. Half are coming back, the other half are going to hold off for a while because of their families' risk protocols and stuff like that, which I fully support everybody's decision. We all need to manage the best we can with what feels right for us. But that being said, I had a great hand into putting forth the guidelines for massage therapy for moving forward. And those include everything that you just said with the wearing the masks. We will wear gloves if our clients ask us to. Both the clients and the therapists will have to have masks on. And that being said, this is very important. Not everybody is comfortable getting a massage with a mask on, right? So there's different ways to work around that. We can do a light drape over the face, which will act as your proverbial mask when you're face up. And then when you're face down and you're in the face cradle cover, we can, face cradle of the table, we can use a pillowcase to make kind of like a little hammock pocket to act as your mask. So I really please want to make sure everybody knows that it's not going to feel like you're suffocating with a mask
that's
on
a big concern.
for massage therapy. But other things that people won't think of that we're doing, literally I put in a lot of money to do that extra step for my office, such as every room now has an air purifier in it. All of the rooms have the touchless or the hand motion activated hand sanitizer dispensers. We have the thermometers, the touchless thermometers, so we can check everybody's temperature. Everybody, as I'm sure you are doing, are the pre-screening and have you been in contact. So it's a very safe environment for sure to come into. And to the point where all of the therapists, actually, we have to change our tops, our shirts between every person. Mm-hmm. So because we're holding limbs, we're holding arms and legs to help with adjustments of soft tissue mobilization and all of that. So that's your skin coming in contact with the side of my shirt. So we have to change. I see 6 clients a day. I'm going to change 6 times a day.
Got it. Yeah, I mean, that certainly sounds like you're doing everything you can to try to minimize the risk of infection and spreading things. And I think, again, it's important for people to start to take some ownership and feel empowered about their healthcare choices and know that there are options available out there for them to feel healthy and to prevent problems from occurring in the future. And I think that conversation has never been more important than it is right now.
Yes.
We're seeing, unfortunately, with this virus that it's not just the virus that is causing death, but it's also the comorbidities. So things like obesity or diabetes or cardiovascular disease. And we now need to make sure that we're shouting on the tops of mountains to say, okay, so if we know that these comorbidities are going to increase the chances of us being susceptible to a viral load, because I don't think that these viruses, as our population increases, I don't think that this is going to be an isolated incident as we move forward into the future. And so it's going to be something where we really have to pay attention to what can we do to make our own bodies as resilient as possible. And with chiropractic, I mean, getting your spine in alignment, clearing out the interference of the central nervous system. That central nervous system directly controls the brain-gut axis, which has a huge amount to do with the immunology of the body. And it's not like chiropractic increases immune function, but better body function increases immune function. And so with massage, it's a similar thing. It's decreasing pain, decreasing stress, increases immune function, and making sure that people feel empowered to know that there are other options that they can reach out for to be proactive and preventative about their health, to make their bodies more resilient in this time is just so crucial. And that's really my big vision for as we start to come out of this pandemic and we start to reopen New Hampshire and return to a semblance of normal life. I want people to feel like there are options available for them, and for people to know that your practice and our practice are here for those people.
Definitely. And, you know, we do the therapeutic massage, but also now more than ever, part of what massage therapy does is it does help the central nervous system by kicking back in the parasympathetics, the rest and digest. And for those out there who don't know, sympathetic nervous system is the fight, flight, or freeze. Mm-hmm. And the parasympathetic is rest and digest. And that goes so much hand in hand, because if you're stuck in an anxiety-driven state all the time, you're not going to be able to digest your food and get the nutrients that you need. You're not going to be able to get a good night's sleep. And when you get a good night's sleep, that's when the majority of body healing happens, is when you're in that deeper level of sleep. So even though we are more targeted towards the therapeutic massage, honestly, after all of this, I see also the regular relaxation massage as being its own kind of therapy, if you will, because we've been so amped up for so long and so stressed out over these last few months because of all of this, that we're just going to need to get everything to settle down. And the other thing that we do a lot at Rejuvenations is we do a lot of education for our clients, so that they have a good home program to do. They're only seeing you for a short period of time. They're only seeing us for about an hour, and then they go on with the rest of their day, the rest of their week. So we really want to make sure that we're giving them some healthy tools so that they can progress and maintain what both your office and ours have done.
Yeah, that's brilliant. And it's such a service to the community. And you hit the nail on the head. I mean, there's so much research out there about stress and that sympathetic or fight or flight dominant nervous system depressing immune pathways, and parasympathetic, the rest and digest nervous system control, facilitating or increasing immune pathways. And that's not open for debate anymore. That has been researched to death. So
yes.
it's such a value for what you're talking about for people.
Yep.
Karen, thank you very much for sharing everything that you guys have been doing over at Rejuvenations to keep people healthy and to let people know that you are here for them. Same thing at Arete, we are here for you guys, and would love to be able to support people in the future. Thanks for being here, Karen.
You're welcome. Thanks for having me.
Yeah, take care.
Bye.